When you are looking for a mental health professional to help you with your needs, you may see many different acronyms, and that's what we're going to be talking about today, what the acronyms mean and what the different mental health professionals do. Hello, my name is Rona Brown. I am a registered nurse, counselor, and marriage and family therapist, and welcome to the Art of Connection Therapy channel, where we talk about connection to God, to ourselves, and to others. I provide educational videos on this channel to help you create and maintain the kind of relationships that you were created to have. Today we're going to be talking about the different types of mental health professionals that you may see when you're searching for a counselor for yourself. So let's talk about the similarities of all mental health professionals. All mental health professionals want to improve people's lives. That's what they work for, whether it's individually, in a couple setting, or with the family. Their goal is to improve the lives of individuals who seek help. Number two, all mental health professionals have to complete at least a master's degree. They have to have that educational preparation before they can become licensed. In addition to that, usually they have to complete some type of exam or certification in order to be licensed. And lastly, all mental health professionals work or can work with individuals, couples, and or families. So those were the similarities with the mental health professionals. Now, what are some of the differences? Well, the differences stem from the origins of how the profession was formed, or the philosophies. So the origins and the philosophies determine the educational preparation that happens in school. Let me explain. So I'm going to talk about the first mental health professional, which is the social worker. In some states, you may see the acronym for the social worker as LCSW, which stands for Licensed Clinical Social Worker. Now, the social worker, again, all of these mental health professionals work with individuals, can work with families, can work with couples. They all can do counseling and some other things. The social worker, though, the way that they were formed, or their philosophy, I guess I should say, is that they provide resources for individuals who need resources. So they help the individuals connect with resources that they may need to help the individual improve their lives. For example, say you have a client that comes in and has the diagnosis of schizophrenia. The social worker can provide mental health counseling or therapy for that individual, in addition to providing them with resources and social support to help them as they manage their symptoms of schizophrenia. Social workers can diagnose individuals. So say, for example, someone comes in and they are working with that social worker, and the social worker is doing counseling with them, and the social worker can diagnose them as having depression. Social workers, however, do not prescribe medications, but they do use therapy and, again, other resources as well to help the individual manage their symptoms through talk therapy, and it helps them to improve their lives. Now let's talk about the counselor. So you have the different acronyms. In some states you can have LPC, which stands for Licensed Professional Counselor. In the state that I reside in, the acronym for the counselor is LCPC, and that stands for Licensed Clinical Professional Counselor. Now, some states may issue the LCPC, or they may issue something that's the acronym is LCMH, and that stands for Licensed Clinical Mental Health Counselor. So you may see one or the other depending on which state that you're in. But typically, what the counselor or this mental health professional does is that they work with individuals specifically to help them deal with their problems. Again, that may be through therapy, through counseling, where they provide symptom management and skill building through therapy. The counselor or the mental health professional can also diagnose. For example, like the first one with the social worker, if you're showing symptoms of depression, you're working with the counselor can diagnose you with depression. However, the counselor does not prescribe medication. If you were looking for medication, you can go through your primary care doctor or a psychiatrist, which we'll be talking about as well. Next, we have the marriage and family therapist. In some states, or the state that I reside in, the acronym for that is LCMFT. That stands for Licensed Clinical Marriage and Family Therapist. The marriage and family therapist, like the counselor, like the social worker, also works through therapy to help individuals, families, and couples. The difference between marriage and family therapists is that in their school or in the profession of marriage and family therapy, the counselor or the mental health professional is trained to see clients through a system lens, meaning that we all know that individuals do not live in a vacuum. Individuals live in families, in communities. So the licensed marriage and family therapist looks at the individual client or the couple or the family through that relational lens. So a lot of the work is seen through the relational lens, whereas with the counselor may see it through an individual lens. So let me give you an example to illustrate what I'm talking about. Someone comes in, or someone has depression. A client has depression. The counselor, while they're treating the client for depression, may focus primarily individually with what's going on with that client that is sitting there. So a lot of skill building, a lot of talk therapy around what is going on specifically with the client. The marriage and family therapist, however, may do the same work, but may also look through the client or look at the client through the lens of system. So the marriage and family therapy will also be assessing for the client and how they are functioning in their family. Are there any family issues that cause the client to have depression? Are there things happening outside of the client's individual world, such as work, such as in the community, that is contributing to that client's depression symptoms? And then we have the psychiatric mental health nurse practitioner. The psychiatric mental health nurse practitioner, their track or their educational preparation is going to be through nursing. That's why they are a nurse practitioner. So after they obtain a bachelor's degree in nursing, they then go for their master's degree or higher in nursing, and they go through the nurse practitioner track. Now, the nurse practitioner can also work with the client through therapy, can also work with the client through counseling. Counseling and therapy are usually used interchangeably. The difference, though, or one of the differences, is that the nurse practitioner can prescribe medications in addition to diagnosing the client. So, for example, let's talk about the client who has depression. The client sees a nurse practitioner. The nurse practitioner may work with that client in therapy, in addition to prescribing that client with medications to help them manage their depression symptoms. Then we have the psychologist. The psychologist also goes to school, completes at least a master's degree, and the psychologist, they typically do not prescribe medications. They work with individuals, families, couples as well, just like the other professions that I talked about. They can also diagnose. For example, the client with depression, the psychologist can see that client and diagnose them with depression if that's what they're showing, or the symptoms are consistent with that. The psychologist primarily looks at the client through the lens of pathology. So it looks at what is causing the client to have the symptoms that they are having. And so that is how the psychologist works with the client through behavioral and talk therapy as well. Now, I want to say that in certain states, there are about a handful or so, maybe a little bit more, of states that do allow psychologists to prescribe medications. But overall, typically, psychologists at this time of this video do not prescribe medications, only with the exception of those 5 or more, maybe 5 to 7 states that allow them to prescribe medication. Lastly, we have the psychiatrist. Now, when we talk about psychiatrists, think medical doctor, because they typically complete a master's degree or go through medical school to become a psychiatrist. The psychiatrist can prescribe medications. They typically do prescribe medications in addition to providing counseling and therapy to help their clients manage their symptoms. So, for example, if you have the client that has depression or that has symptoms of depression, they work with the psychiatrist diagnoses them with depression and then can prescribe them, just like the nurse practitioner, with medication to help them manage and treat their depression symptoms. Now, there are many different types of mental health professionals out there outside of the ones that were talked about in this video. Again, you want to keep in mind that the goal or the mission or the passion of the mental health professional is to help improve the lives of others. The difference is by how they view the symptoms or the diagnoses that the individuals present with. Another thing I want to point out is that a client may be able to see two different types of mental health professionals simultaneously. So the client with schizophrenia, for example, the client may see a social worker and a psychiatrist at the same time. And actually, the social worker and the psychiatrist may work together as a team to be able to best help the client. So the social worker may be the one that is providing the weekly therapy sessions, and the psychiatrist is the one that is helping to manage the medications for the client or with the client. So as the three of them are working in conjunction, then the client gets the best care because now they have an actual team who is working together to help the client improve their lives. If you found this information helpful, please be sure to like and subscribe to this channel. You can also hit the notification bell to know when I post new videos. And you can check out my website at www.theartofconnectiontherapy.com. Thank you for watching. I will see you next time. And always remember that connection is an art worth mastering. Take care.